Hi there, my name is Shane Lamba, and today I'll be presenting to you all the Community Health Assessment of Santa Clara County. So, as a starter to the whole presentation and just an understanding of the community of Santa Clara, I thought showing this ArcGIS map of the border and the perimeter of where Santa Clara County reaches, and for those who may not know, the geography and demography of Northern California. So, Santa Clara County is a county in the Bay Area, which is part of Northern California. So, as you can see on the map here, it's quite large. It's actually the largest county that is in the Bay Area. As you can see, there are many types of centers. There's urban centers, such as San Jose, Santa Clara. There are rural areas, such as Gilroy and even the Valley. And then there's suburban areas, which are just kind of scattered all the way through. So I just wanted to give this as a glimpse and an understanding of what Santa Clara County graphically looks like. So jumping into understanding our community or the Santa Clara County requires us to understand the sociodemographic characteristics. So what I found was that in Santa Clara County, more than half of the individuals identify as white. And then the second largest racial ethnic category is actually Asian Americans at almost 40%. And so the comparison county or community that was chosen was actually Alameda County, and that's actually just north of Santa Clara County. And you can see that there's some comparison data of California and the US national averages as well. What I would like to point out is that African Americans or Black people in general only contribute about 2.8% of Santa Clara County's populace. And it is really important because this is going to be a moving target for us to approach, especially with the following health priorities in terms of race and ethnicity. And Latinx or Hispanic Latino individuals comprise up to 25%, which is much higher than the national average and is pretty much a little bit lower than the state average of 40% in California. So in understanding more about the community itself, I think socioeconomic factors are quite important. So the median house cost in Santa Clara County is $984,000, and this is almost about 5 times higher than national estimates. So there's quite a big gap there. People are spending a lot of money for their houses here in the Bay Area, specifically Santa Clara County. And it's almost about 1.3 times higher than the state estimates. And then this kind of relates as well, household income is about $124,000 here in Santa Clara County, which is about 2 times higher than the median US income and almost about 1.5 times higher than the state national average. So as you can see, the socioeconomic profile shows that Santa Clara County is pretty well built, and the people who live here or people who are planning to live here, it requires a lot of money to invest themselves in the community. And what kind of goes hand in hand with socioeconomic principles are poverty and employment rates. Santa Clara County actually did quite well in terms of the high prevalence of people being employed, and this could be brought on due to the rising tech industry, as well as having a lower than national and state average and neighboring community in terms of poverty rates. So we're excited to see that the poverty rates are so low. However, we should still understand that there are some discrepancies and understanding what may be further needed in terms of an investigation. So moving forward, I'm going to present some of the health profile indicators that I thought were pretty pertinent and kind of give us a glimpse as to what the whole rest of the community health assessment was really set out to do. So the 3 health indicators that are chosen to present today are obesity, type 2 diabetes, and heart disease mortality. So Santa Clara County actually has quite a low obesity prevalence of obesity. It sits at 19.1%, and this is almost half of national averages. So, they're doing pretty well in terms of obesity as an overall health indicator. However, when we do look at obesity in terms of racial and ethnic minorities and using this health equity focus, we see that 33% of the people who are obese identify as Latinx or Latino Hispanic, and 26% of those individuals identify as African Americans. So, just to understand again, that only 3% of the population of all of Santa Clara County identify as African American. So seeing these disparities just in the presence of obesity, should bring us to some underlying and root cause analysis. So type 2 diabetes, I didn't want to show the prevalence rates because I thought it's more important to show the hospitalization rates. And in African Americans, it's almost 3.5 times, they are 3.5 times more likely to be hospitalized due to complications with type 2 diabetes. And Latinx or Latino Hispanic people are almost 2 times more likely to be hospitalized due to type 2 diabetes complications when compared to the overall average of Santa Clara County. So this should bring some light in terms of understanding that a lot of the preventative areas and the barriers to care that I was able to understand from my interviews with both the director of community health and a nurse practitioner, they really echoed on the barriers of care concerns when it comes to preventative health management. And then lastly, CDC notes that heart disease or death from heart disease is the leading cause here in the US. So it's really important to understand that Santa Clara County as a county overall did pretty well in terms of the markers for mortality rate, quite low compared to the national averages. But however, African Americans are almost 2 times more likely to have mortality from heart disease compared to the general county itself. So the chosen health priority area, as you can see, I have focused on HIV, and I want to go a little bit more in detail about HIV/AIDS here in the county of Santa Clara. So as you can see from this figure, Santa Clara County's prevalence rate actually is quite low. It's half of almost all the comparison counties. However, when I looked a little bit deeper and I tried to understand what may be going on here, I actually found a lot of different variants when it comes to racial and ethnic minorities. So that kind of became the focus priority area for me. As you can see in these in this table in the figure, you can see that African American males who are aged 13 or years or older are actually 4 times more likely to receive an HIV diagnosis compared to their white counterparts, and almost very similarly are Latino males in general. So there's a 3 to 4 times a higher chance of being diagnosed with HIV for those males aged 13 or higher. And we can also see the trends, right? The trends somewhat increase over time, but then also kind of plummet back down when it comes to just new HIV incidents or diagnoses for the last 5 years. So it's really important to understand how trends can change and possibly what are the factors underlying those changes. And in the next slide here, you can see on both of the tables, I've actually outlined the egregious difference in terms of African American case rates versus white individuals versus Hispanic Latino. Almost 6-7 times higher in African Americans when it comes to being when it comes to living with HIV. And we should really note again the population percentage of Santa Clara County is only 3%, whereas for the white individuals it's more than half, whereas for Hispanic it's about 25%. And the same goes with our state averages, right? And when we're looking at the state, these are kind of somewhat in line with African Americans, but we should still be weary of that because the state population average is 11%, almost 3 times higher than it is for the county of Santa Clara. So when trying to address, a lot of these health issues, it's really important to focus on community assets and capabilities. I've found some strengths and weaknesses. Some strengths are the core integrative Santa Clara County Public Health Department. There's a strong tie with the stakeholders around him and also with the Health Trust, which is a key community partner when it comes to HIV case management for those who are disadvantaged or marginalized communities. As well as the Billy DeFrank LGBTQ+ Center. They focus on HIV education for LGBTQ people. As well as some of the weaknesses, I thought it was really sad to see that there are really limited faith-based organizations. The only one that I could find was the Bill Wilson Center. The faith-based organizations have been shown through research to help community support and engage individuals to prevent and to stick with healthier behaviors over time. And just overall, there was this limited minority health focus in a lot of the programs and assets that we see here in Santa Clara County. So that could be a pain point and something to be worked on in the future. So I'm going to outline 3 policy and program recommendations for us to attack the kind of gaps that we have here in Santa Clara County. I would like to say that we for sure should be creating an African American Latinx coalition. This should be under the direction of the Santa Clara County Public Health Department. I want to focus on culturally competent education. We need to also understand the barriers to care when it comes to research and also program development. Secondly, I would want to focus on collaborating with schools to enhance these HIV strategies. Schools are a thoroughfare for public health messaging and campaigning. We want to connect the schools with the right resources so they can make the right modifications and right upstream change as time progresses. And lastly, I want to connect faith-based organizations with HIV prevention strategies. I want to assist those FBOs with creation of materials. I want to provide them with an outreach liaison when it comes to the Santa Clara County Public Health Department goals and visions. And I also want to start small. I think we need to start small with posters, flyers, handouts, little things that can be, integrated as time goes over and just can raise general awareness within these communities. As we see, racial and ethnic minorities often use these faith-based organizations and spiritual cultural centers more often than their white counterparts. So overall, Santa Clara County is a well-built environment. They do favorably well on most health outcomes. We can say that HIV is a pressing topic when it comes to racial and ethnic minorities, and the assets are widespread, but there still needs to be some room for improvement. And I hope these recommendations can be effective enough to make that change happen in the near future. So I just want to say thank you for your time and hope you enjoyed my presentation.